Everybody ready? Very good. Good afternoon. I'm House Republican Leader Ken Fredette of Newport, and I'm pleased to be joined by Assistant House Republican Leader Ellie Espling of New Gloucester, as well as some of our members from the House Appropriation Committee, the Health and Human Services Committee, and the Criminal Justice and Public Service Committee. I'd like to talk about the upcoming session, our priorities, and where we currently stand on a variety of challenges we will undoubtedly face in the coming session. House Republicans have and will always be steadfast in our commitment to control state spending. We will not waver from that commitment as we head into this session. That being said, Maine's drug epidemic is at the forefront of everyone's mind. Make no mistake, Maine is facing the largest drug epidemic in our state's history, and we will take action. However, we must make sure that a comprehensive plan for drug treatment and prevention is thoroughly vetted, not blindly throwing money at it as a problem that is in search of an answer. We intend to have our House committee members take their time, listen to the bill that's presented, ask questions, and make sure that it's done and done right. At the same time, our state currently spends approximately $71 million on this issue. We also need to look at those existing programs so that we make sure that money is being spent correctly there, or could it be rediverted to this issue. In addition to the drug crisis, we also face a number of issues that's going to be facing us this session that cannot be overlooked. And that's why we need to take our time looking at this specific issue. Tax conformity. Maine must now decide whether or not to comply with changes made by the omnibus federal spending bill passed earlier this month in Washington that alone could carry a price tag of $20 million for each year of the budget for Maine taxpayers. That's approximately $40 million. It's mostly depreciation and Section 179 depreciation. And it's something we did pass last session, tax conformity. And again, it's something we typically have done when we come into session. We look forward to that conversation. Again, that could carry a price tag of approximately $40 million. We also have the ongoing issue regarding our jails. We carried over a bill to address the ongoing issue with our county jails. It will ultimately cost more state money. It's something that's been a work in progress for some time. We obviously need to reform that. And that's going to be something, again, that's going to require work from our Criminal Justice Committee. And it's also going to require dollars. And again, that's, again, a big issue for the House Republicans. And then recently, the voters recently passed the Maine Clean Election Act, which again has amended current laws as it relates to that, and is looking for approximately $7 to $10 million to make sure that that is fully funded in regards to state, particularly in this election cycle, state house races and state senate races. And so again, we're looking at another price tag there somewhere between $7 to $10 million. Additionally, we have another issue in regards to the indigent legal services, which was only partially funded in the last budget cycle. It's going to have to be something that's going to have to be looked at. Likely is going to require additional dollars. Again, it's going to put pressure upon our legislators, particularly on the Appropriations Committee, in terms of funding that issue, as well as, for example, the drug issue. When you add it all up, we could be looking at a very significant budget shortfall, even before the process begins. And addressing drug treatment obviously is going to be a piece of that. But we want to make sure that we take our time, do it in a smart way, in a thoughtful way, and not to simply rush to judgment in terms of passing a bill for the sake of simply passing the bill. We understand that the governor has currently found funding to address the immediate issue, which is the MDEA agents that he needs. And so that immediate emergency issue is being funded and is being taken care of. And so we think that the process going forward, again, in regards to drugs, needs to be looked at as part of a piece of the larger problem that we're going to have with the budget. House Republicans will not allow the challenges that we face to lead to an explosion in state spending, cuts to services to our elderly or the disabled, and an increase in taxes. With that being said, we will answer any questions on the upcoming session, and we look forward to the hard work before us.
Representative Fredette, you saying no new spending?
I'm going to leave that up to
I'll say it no increase in spending.
I think we're going to let our appropriators work that issue. We have 4 great appropriators that worked on the budget last time, They know the budget well. Obviously, we would not be in favor of more spending, but obviously we recognize the significant challenges out there, and we're going to have to balance that in regards to the needs versus what is available for spending. Obviously, we would like to keep spending at a current level where we've already passed the budget.
Representative, one of the reasons that the governor has pushed for the MDEA agents is to halt the trafficking, and he's made the argument that those additional resources are required to meet that challenge. There is a similar push for treatment and recovery, and particularly medication-assisted treatment. Are you confident that the level of spending is meeting that demand, that rising level of demand, given the status of the epidemic?
Deb, want to speak to that, or folks?
I can speak very quickly to that. When we're looking at, the drug enforcement agents that we need they're desperately needed. We need to stop the flow of heroin and other illicit drugs coming into the state. Right now, we don't put enough resources in there, so there is an open flow of these items coming in. When it comes to the treatment phase and the funding for the treatment, right now we spend a lot of money, almost $80 million a year when you add it all together towards substance abuse treatment and recovery systems, medication-assisted treatment, counseling. Before we spend any more money on that, I think we need to slow down, take a look at exactly what is out there, what is the level of efficacy for the systems that we already have in place, and then make sure that anything that we add new to it, and we're not opposed to adding anything new to it, as long as there is an evidence-based model that we can look to that has been fruitful and worked, okay? But we want to make sure that what we're doing now, if there's something that's not working, then what we do is we change that and move it to something that is working overall. So that's kind of where we are on that.
How do you feel about the plan that's going to be vetted beginning tomorrow? Your committee will be a part of that process. We've seen probably the draft legislation. Have you had a chance to assess whether that's helpful, whether the caucus can support it, or is it really just about the agents?
Well, we've looked at the plan. I've looked at the plan. I've asked several questions about the plan. My biggest concern is the huge push to rush it through all at once. This is a very, very big issue, and I am not willing at all to allow that to be pushed through without a full vetting of, again, the programs that we have, what we're actually trying to do here, where the resources are going to go to help the individuals who have substance abuse issues and need the help. So I think we need to slow this down, and if we don't slow it down, it's not something that I personally, I'm not going to speak for the caucus or anybody else, but if we don't slow it down and give it a full vetting, it's not something that I'm going to support. We need to vet everything.
Representative Fredette, you talked at the beginning here about, you kind of had this list of numbers for where we might have, money issues. Do you guys have any sense of where we're at on the revenue forecast, and is there any chance that you're going to see some of that offset by forecast revenue?
I'm guessing that
There's, in the last revenue forecasting coming out, it's looking at the end of the cycle, approximately somewhere in the $5 million to $6 million range when we get all done.
You mean surplus?
It's surplus. It's not like there's a great big pot there, but we won't know again until it's done. Revenue forecasting is done. I think the very 1st of February, end of January, they redo revenue forecasting, so we'll have a better projection of where we are at that point in time.
But let's be clear. This last budget was an increase of $300 million over the prior budget. I think we've done plenty of spending, and so if there's needs that we can work around in terms of reworking parts of that funding, I think we'll look at that. But in terms of adding additional spending onto the existing $300 million increase, I think that is going to be something, whether it's jails, drugs, conformity, is going to require a pretty serious conversation.
What's the estimated dollar amount on a shortfall? Is there any number?
Well, so I think it's clearly my understanding, I don't think it's a surprise to anyone, that the governor's not going to put in a supplemental budget. So we don't sort of have that comprehensive package which we really would look at in terms of requests for additional spending and what might be the additional offsets to pay for that. So, you know, my guess is you're probably going to see this coming in piecemeal as different bills. And again, that's part of the concern is in regards to even this drug treatment piece, which is we need to look at that in the bigger picture of conformity, jails, indigent legal services and whatnot. I mean, that's the real challenge.
Would it be easier if he gave you a supplemental that you could jump off from? Would it be any easier if the governor provided you with a supplemental that you could jump off from?
No, there is no supplemental budget, nor do I expect there will be, provided from the governor's office.
Are we talking like tens of millions of dollars, presumably more than $5 million? Can you give us any sort
Well,
of...
again, I think you're talking even for 1 year conformities, 20 million. You're talking about indigent legal services, which could be, you know, I think anywhere from $3 to $7 million. You're talking criminal justice academy wasn't properly funded, $5 million. Clean elections, $5 to $10 million versus where that falls. You know, so I mean, again, I think we're looking at, I think you could conservatively could say $20 million, but maybe upwards of $40 million, depending upon how all those numbers came together. It's a pretty significant challenge, I think.
Is there a price tag on jails?
Depends on what the bill looks like. You know, what's the
How
proposed
much it
fix
goes to
on
the county?
Yeah, I mean, Washington, Worcester County, I mean, you know.
I mean, how much the counties pick up and how much the state picks up?
Yeah, or what's going to be the tapering off of the state funding to the local jails. I mean, that's part of the question as well.
When the governor issued that financial order to cover the MDEA agents in the short term, he did that with the expectation, he said at least, that the legislature would backfill that money for appropriation this session. The Senate President has talked about getting that bill to the governor by mid-January, or perhaps by the end of the month. Just wondering how those factors, in your opinion, will weigh into that discussion, particularly the backfill.
We have no interest in rushing the bill to the governor if it's not properly vetted, whether it be on the financial side or on the piece that looks at the drug treatment and prevention, in addition to the more complicating factors of the other demands for spending in the budget and you know, possibly the reworking of spending under the currently passed budget.
Representative Burnett, the Democrats are saying that probably on Wednesday, some order will be brought to the floor regarding the governor and Goodwill Hinckley censure, something of those sorts. Do you expect that, and do you think it will recognize it? We probably will oppose it. Do you think that it would be good to get that discussion out of the way on the first day?
Well, you know, let me be clear on really, again, what I think is just a fundamental problem here. Starting of session is roughly 36 hours away. There's been conversations about an impeachment order coming to the floor of the House. Not one single member of my caucus, nor my staff, has received a copy of an impeachment order. We've heard about it. We've had the media say they have a copy of it. We do not have a copy of it. So I think it's inappropriate to have this coming to the floor of the House when, you know, we don't even have a copy of it, even a draft copy of it. I mean, this is a fairly significant process here. I mean, let's be very clear here. Paul LePage was elected by the people of the state of Maine with the largest number of votes approximately a year ago. An impeachment process is an attempt by 151 people in the House of Representatives to basically overturn and remove from office that person that was elected, duly elected by the people of Maine. This is a very serious issue. And for the Democrats to suggest that they're going to bring an impeachment order on the first day of session, having not provided us with a copy of that, 36 hours out, I think it's just totally unacceptable.
What about a lesser proposal, censure, whatever it gets called, which is also being talked about?
Well, again, I think a censure is something that, again, is warranted if they want to talk about it. But they have to provide us with the information. I don't think anybody, whether it be the media or the people out there in the state of Maine, should expect us to show up here on Wednesday morning for a caucus an hour before we start session and be handed articles of impeachment or a censure order and say, what do you guys think about this? Now let me add on to that another piece. In the Constitution, it says that the House of Representatives may be able to impeach, can impeach. But it doesn't lay out any rules for that. So I have real questions on the process in terms of what is the legal process? We've never done this in Maine before. I'd like to have the opportunity to have an attorney advise us on what the process is, advise the caucus on what the process is, because this could set precedent for the future. Because there is no law in place that says what is the process for impeachment in Maine. There's House orders and joint rules, but I mean, is that how we're going to do this? Again, it just goes to the fundamental issue of this is a constitutional process of attempting to remove one person who represents a third, one of the three branches of government. This is not the way to start this session.
You're laying down some lines here as we go into the session on the drug bill that are at odds with the rest of the legislature. The House Republicans, as I don't have to remind you, were at odds with the rest of the legislature on the budget this year. And you've said a couple times this isn't a way to start the legislative session. I'm just wondering if you kind of respond to that through the lens of what you said here today.
Meaning what?
Can we expect any collaboration or any work to get done, or are we looking at another year of disagreement between House Republicans and the rest of the legislature?
I think that we stand ready and willing to collaborate with anyone that would like to collaborate with us. I think it's been very clear and apparent to us that sometimes these things happen without our input. And take the drug bill, for example, just in the issues and the solutions that brings forward. You know, House Republicans have a lot of good ideas as far as substance abuse and treatment and prevention, and to have those ideas, not heard. We would like to present those ideas. Hopefully, we will in the coming days this week. But we stand to contribute a lot to what the legislature's work is, and we would like to be part of that. And we have a lot of good ideas, and I think sometimes those ideas are discounted. So, we stand ready and willing to work in a collaborative fashion with our colleagues.
Do you expect anybody from your caucus to participate in tomorrow's public hearings in terms of bringing forward some of these ideas that you just mentioned?
Well, I think we have committee members here, all of who have been briefed on what the proposals are. I think they all do have ideas and suggestions, and they stand ready to be present at a hearing and whatnot, and to provide input. And again, then bring that information back to the caucus on what are the opportunities that we have, what might we support, and what might we not support. And to follow up on what Representative Espling said, I will indicate, I've had some good conversations with Representative McCabe in regards to the upcoming start of the session. I did have a coffee with Senator Thibodeau on Saturday, and so the lines of communication, I think, are better and open as we start the session. But I think the issues and the way we're starting the session is really what the challenge is.
A question regarding back to the drug bill. You want to slow it down. Are you committed to, you're not talking about slow it down beyond this session, are you?
Yeah, no, I don't think that there's any intent. I mean, we understand what the need is out there for the drug crisis, whether they be MDEA agents or treatment. But that's not, I don't think, what our intent here is and what we're talking about. What we're saying is that needs need to be looked at in terms of the larger context of the challenges before us. Because we do have clean election demands, funding for that, and because of the jails, and because of the conformity, all that needs to be looked together rather than simply driving the bill through in the first 2 weeks that hasn't properly been vetted.
And to talking about anything beyond the session, I mean, the drug epidemic is not new, and it's just kind of changed, and it seems like we have an immediate crisis on our hands. We need to look at it as a long-term problem that requires long-term solutions, and I do think that there will be a need for looking at it beyond the session. I don't think it's something that we can just put a Band-Aid on right now and hope that it goes away. It's not going to go away, and I do think beyond the session we should think of it as a priority and look at long-term solutions in the future, and that may require into the next legislature.
I mean, haven't we been talking about new drug agents for a couple of years since the governor has been talking about them? And I mean, I've sat in plenty of meetings where I've heard people from the treatment and recovery side talk about the need and how many beds we have and all this. I'm just wondering what new ground you think we need to cover starting this week.
You got to remember, in the last budget when it came out, the governor had the drug agents in it, he had 10 drug agents in it. And the $2.5 million we're talking about for there isn't one of us, whether it be a Republican, a Democrat, or an independent or a Green Party, that doesn't have some family member or some person that's been involved with a drug or an alcohol or some substance abuse problem. So we all have a heartfelt desire, including myself personally, to address this issue. But we're spending today, folks, about $80 million on drug abuse. 71 million we're spending in the state, 30 million out of the general fund, 41.5 million federal dollars out of that 71 million, $8 million historically on transportation for drug abuse. So we're pushing the $80 million mark. If you think that $2.5 million shoved through here in the next week is going to be the magic pill that stops drug abuse and use in the state of Maine, I'll be the first one to sign the bill and pass it on. I don't truly believe that $2.5 million is the magic pill. I want to look at where, me personally, and I'm only speaking for myself, personally believe that the money that we're spending needs to be reviewed, and what do we expect for a success ratio out of that $80 million? You know, what do we think the field should be? Where should our success be? Should it be 10%, 5%, 20%, 30%? Where should it be? Until we know where that is, why would we start spending more and more money? You just can't keep throwing money at it and think that's going to fix the problem. It's not going to work, folks. Until we address the problem and do a total analysis of it through this session, let the bill work through the committees, take it and be vetted the way it should be, and then come back to us, and before the session's over, we can act on it. But I don't think the drug situation is going to be fixed today. The drug agents need to be hired. The governor's found a way to do it. We can move forward, and I think we move this session forward in a unanimous and somehow work together and find some solutions to work together in this.
In terms of getting that information, do you anticipate, I mean, I know there's been some, I don't know, hand-wringing over cooperation from the administration on bringing testimony before committees, and do you anticipate there's going to be kind of a change in procedure there so that you'll get the information from the departments that you need?
Part of the information that we need is from the advocacies who provide the services themselves. We don't need names. What we need is the aggregate data with the number, their rates of success, their rates of recidivism. That's what we really need. We never get that from the advocacies, and depending on which provider, which service that you speak to, you get a different level of need for different kinds of treatment. It's all over the place. And until we can put it together on one big board and take a look at everything globally, not just in a silo, because that's what we get, is these little silo efforts. We need to look at the broad picture, find out what we're doing well, put more resources to that, what's not working so well, maybe not do that anymore, and make sure that the people, that what we're actually doing is helping the people who are affected with drugs. We're not doing a very good job on that, and that's why our rates keep climbing. That's why our rate of drug-affected babies keep climbing. We're not doing a good job.
Or whatever it is more of a peer support organizations, or are you talking about the people who are providing outpatient services?
Oh, we need, if you're going to look at this as a global effort, if you're going to put in an omnibus bill that's going to target many different areas of drug addiction, we need to hear from all of them, and we need to be able to have the time to compile all this information into one cohesive spot so we can take a look at it all. Otherwise, we're only going to be taking a shot in the dark at what we might think is going to be the best. Now, we're not opposed to spending money on stuff that is efficient and actually works or has a higher rate or percentage of success. Any kind of drug addiction treatment or substance abuse treatment or medicated assisted treatment and recovery programs, none of them are 100%. Not a single one of them are 100%. But you want to make sure that what we're doing has a higher percentage rate than what I think we've got right now. I mean, if we can get into the 20 to 25% success rate, I think we'd be doing well. I think it's much lower than that right now.
Just votes, do you expect that work and this analysis to be done by the HHS committee, or do we need a special committee or a consultant? Or?
Well, see, and that's the whole process with the work committee, and that's what's the shame about trying to drive this through in just 1 week. It's crazy. I mean, we've got a public hearing scheduled for tomorrow, and then they have a work session for the HHS portion of it scheduled for Wednesday afternoon, Thursday afternoon, with a report back out on Friday. Now, I ask you, can any of you imagine, possibly imagine, that we are going to be able to gather the information that I think is necessary to make such a broad decision on a treatment center in Bangor or the extra peer supports and everything in just 3 days? I don't think so. We need to make sure we're doing the right thing here.
Are you confident you have all the information and detail you need about what we're currently doing from DHS?
From DHS, I've got a fairly good idea, but what I don't know is the advocacies out there. Who else do we have out there? What other programs do we have out there for residential treatment centers? I know there's a couple in Bangor and a third one coming up. So does that mean do we need another detox center in Bangor? Would that, if you're going to put the money toward that, would that be best served in another community? These are all the kinds of questions that I want. Who does it? How many people are they serving? What is their rate of success? Should we be putting these resources into another community where maybe they don't have that available, or should we do it at all? Are we going to get those answers in 3 days? I don't think so.
For appropriations committee members, can we go back to that supplemental question? I asked you if it was any easier when the governor gives you a roadmap, and you said, no, the governor's not going to give us a roadmap. But the question was, is it any easier when you have a budget document to work from than when you don't?
Before we answer that, I do just want to say I talked to the administration today, and I understand that both Commissioner Morris and Commissioner Mayhew will be available tomorrow if there are questions from the committees.
As far as the governor submitting a supplemental or going through the process, I think his past record has shown that when he does that, it doesn't get paid a lot of attention to anyway. So it gets rewrote, and last year it was done in little bills and created a little bit of havoc that was generated throughout the department. So he says it's up to the legislature to write this, and in his mind, that's what I believe he feels. And so it'll be up to us to look at the budget and where we're at, and we have some bills within the appropriations committee that we can deal with at the time when it becomes necessary, when we know what we have to deal with. At this time, it's all speculation of where it's going and what's going to happen. But until we get something to deal with, we'll have to wait and see, and then we'll deal with it.
Good. Thanks, guys.